Good evening, guys. I'm Dr. Vinayak Rengan, and I'm a surgeon. I'm a pediatric surgery resident at SMS Jaipur, and I'm going to be a mentor on the Mortimer Green app, along with Dr. Rohan Khandelwal, Dr. Praveen Sekaran, and Dr. Pravin Sundaram. We four surgeons are going to guide you through the entire MRCS Part A process, especially if you're preparing for the September exam or any exam in future. And Mortimer Green is an organization which has been guiding people for MRCS, both Part A and Part B, for the past few years. And more than 300 of our alumni are right now in the UK doing various jobs, mostly surgical. And we are excited to know that you could be one of them. So let's proceed. I'll be talking about MRCS Part A in general, and this will be for 15 minutes. And at the end of this, you are allowed to ask me anything. So the MRCS Part A exam is conducted jointly by these four royal colleges. So you will be applying through one of these colleges. So these are the RCPS Glasgow, RCS Edinburgh, RCS England, and RCS Ireland. So the application process is going to be through either of these colleges. You can apply through the RCS England, Edinburgh website. Most people in India prefer to do through Edinburgh or England, mainly because of tradition. I applied through Edinburgh. A lot of people have applied through England. Edinburgh is the oldest college. England is also a very prestigious college. So you can go through any of it. It really does not make a difference. There's a slight difference in fees for the exams. So approximately it costs you around 50 to 60,000 rupees. Ireland is slightly cheaper. And once you complete your MRCS Part A and Part B, you will have to pay an yearly fee. Averages somewhere between 13,000 to 18,000 every year you'll have to pay. And this is in Indian rupees. So regardless of which college you sit for the exam, you will take the same examination. And this is an entry-level exam. This does not make you a surgeon at the end of the day. So this is to help you enter into the surgical training pathway in the UK. It is not recognized as a complete surgical degree. You are not allowed to independently operate just because you have an MRCS. And upon clearing the MRCS exams, surgeons enter the NHS at an ST3 stage. If you're an international surgeon or an Indian graduate, you can write the MRCS Part A anytime after MBBS. Please note, you'll have to complete your internship and have your internship completion certificate with you. However, before Part B, I personally recommend that you get some sort of surgical experience. You work as a surgeon, especially if you are planning to enter into, immediately after MBBS. For people entering immediately after MBBS, there are two routes. One is the PLAB route and another is the MRCS route. There are major advantages and disadvantages, and that's something which Dr. Praveen Sekaran has covered. You can check that out on our YouTube channel. Ankur, you can share that link as well anytime. And also, Dr. Gopika has conducted a webinar about how you can pursue your exams after MBBS completely, how you can pursue your surgical training, MRCS after MBBS. So that's something which we can post in the group chat as well. So once you complete your MRCS, you're eligible to apply for these jobs. CT is ST3, plastic surgery, emergency medicine, trauma and orthopedic, general surgery, thoracic surgery, ST4, oral and maxillofacial surgery, urology, auto ENT, otolaryngology. But the Part B is slightly different, vascular surgery and pediatric surgery. However, you would want to know that if you are a post-MBBS person, it makes sense to apply at ST1, ST2 rather than ST3, because at ST3, a little bit of surgical competency is expected out of you. So application, it's an online application. The dates will, for the upcoming September exam, the closing date is 27th June 2024. The exam is conducted thrice every year. One is in May, September, and January. So the exam dates end about 3 to 4 months before. And you'll have to choose a center 45 days before the exam. And that happens on the PSMU website. So you'll have to apply online. And if you are an international student, don't make the mistake of doing it intercollegiate MRCS Part A online. No, that's not it. This is not it. So you'll have to apply through MRCS Part A International. So I've pasted the screenshot very clearly because of this particular reason. A lot of you make the mistake of applying for the UK MRCS, but you will have to do through the international one. And that's what you are eligible for. Only if you're a UK graduate, you're applicable for the other one. And the exam is going to be held online. When I mean online, it's not going to be at home. Only during the COVID period, it was held like that. It's going to be held at a Pearson VUE Center. Pearson VUE is an exam testing agency, and they conduct exams. And you will have to choose the date 45 days before the exam. Be very careful. Keep looking at the website. Keep looking at our Mortimer Green groups, because the exam slots get filled very quickly. It's available in even smaller cities, tier 2, tier 3 cities as well. You'll have centers. You have centers in Mohali, Indore, Jaipur, as well as the bigger cities, Chennai, Bombay, Hyderabad. So you have a lot of options for the center. So you will not have to travel too much for your exam. The exam is split into two parts. There's a part one and a part two. The paper one is applied basic sciences. We are talking about anatomy, pathology, surgical microbiology, surgical pharmacology. Thankfully, there is no biochemistry, so you don't need to worry about that too much. And this is the most important part of your exam. It has about 180 questions, the big chunk. And that is one reason why people post MBBS tend to do extremely well in exams. This applies especially for international medical graduates. So if you're writing your Part A, you can do it immediately after your MBBS, or just before you enter into your post-graduation, or if you directly want to go through the MRCS route. The second part is principles of surgery in general. It has 120 questions, and this were 2 hours. In the first part, 180 minutes, there's a 10-minute break after 90 minutes, just as a comfort break. And one thing which I always like to emphasize is that in applied basic sciences, the chunk is anatomy, 70 to 80 questions. So if you're good with anatomy, there is absolutely no way you will not pass. And that's something I always keep emphasizing: read your anatomy well, read your anatomy well. If you do anatomy well, there is absolutely no way you will fail in this exam. Competency is tested. There are 10 basic modules. Basic science knowledge relevant to surgical practice. We are talking about anatomy, pathology, pharmacology. It'll all be related to the surgical specialties. They're not going to ask you pathology, which is kind of completely unrelated to what you would see in your general surgical practice. Common surgical conditions, basic surgical skills, assessment and management of the surgical patient, perioperative care of the surgical patient. This is one of the most important components. There's going to be a lot of questions in this, and the Mortimer Green app covers this in detail. So please do make sure that you solve all the questions in the perioperative care. Absolutely important. Again, trauma is important. Pediatric surgery, management of the dying patient. Transplantation is a big chunk of your questions. Also, professional behavior and leadership skills. There's a video on YouTube where I talk about ethics for MRCS. So that's a very, very, very important topic, and you will have to make sure you learn that. We cover those topics in our test and discussion as well. And I would suggest that you enroll in our test and discussion if you're planning to get into your prepare for your MRCS Part A September session. Scoring pattern: 300 marks, no negative, 1 mark per question. So approximately, because there's no negative mark, I would say that you have to attempt all the questions. Minimum score of 70%. Now that's slightly subjective. It can be 69% or 72% or 73%. It really depends on which college you're writing, and it varies year to year. And the pass percentage for international test takers is based on the performance of UK candidates in the same exam. So it really depends on how tough the paper is and how the UK candidates have performed. Based on that cutoff level, your cutoff mark will determine. On an average, it's around 69 to 73%. It's advised to aim for at least 75%. I would say go for 80% minimum. Only then you can pass comfortably. And one thing I must tell you is that the standard of exam is increasing every year. And that's one of the reasons why I started the Mortimer Green app. The exam standards are increasing. The recalls patterns are changing. And the existing resources which were available are kind of at a lower level. They are standard questions, easy questions, but because the exam pattern is getting tougher, I deliberately made sure that the Mortimer Green has a little higher standard of questions to make sure that your preparation is up to the mark. If you're able to solve the difficult questions, you can get your easy questions right. So don't get disheartened when you start solving questions on the Mortimer Green app, because initially it's going to be a little difficult, but you will realize that the exam pattern is suited for the difficult questions. There's a lot of higher order thinking questions in surgery which are coming, and that's something which we specialize in. So I would kind of recommend you to be cool and approach the exam with a lot of clear mind. So eligibility for the exam. So you must hold a primary medical qualification. As I already told you, an MBBS degree is enough. So you don't need a GMC registration, but you should be eligible for GMC registration. That is, there's a list of universities and medical colleges in the RCS websites, GMC websites. Your medical college should be one of them. And unless you are eligible for that, you cannot write your MRCS Part A exams. It's going to be very difficult. You need to go through a long process. If your name is not there, if your college name is not there in one of those lists, there's a other specific set of documentation you need to certify. So all you need is a basic MBBS degree, and most colleges in India are eligible. The only problem can occur if your university name has changed and your university name is not visible in that list of universities which are eligible for MRCS Part A, and that's a bit of a problem. But you can get around that. You'll have to mail RCS, and they will give you a set of instructions to follow. Candidates from UK can take the Part A exam during foundation years, FY1, FY2, or during core training. What documents do you need? You need a passport and your MBBS degree. Your MBBS degree copy should be attested by your head of department, current head of department, notary, or a British council, saying this is a true copy of the original. Originally, you were supposed to send the documents by post. Nowadays, even mail is enough. You need a valid passport for your exam. If you're not applied for a passport, as soon as you apply for the exam, try to get your passport. Suppose you're not able to get your passport, a valid photo identity card, maybe a voter ID card or a driving license. Driving license is great because it has your signature as well as your photo. What's the time needed for exams? Oh, I have a very simple rule. The rule is the rule of 3. You need 3 months of preparation, 3 hours a day. It can go aage piche. Sometimes you might miss about 3-4 days of preparation. That's perfectly okay. But the general rule is if you can allocate 3 months of preparation, 3 hours a day, that's great. And the preparation varies for different people. If you're a post-MBBS person, you will need to concentrate more on surgical aspects. So Bailey and Love is going to be your Bible. You will need to spend a lot of time reading surgery. If you are a practicing surgeon, 3 years post-surgery, or a surgery resident, your mind would have been fuddled. You really don't remember all the basic sciences. You may not remember the anatomy of the cingulate gyrus in the brain or the number of holes in the base of skull. So you will need to spend more time with basic sciences. So the amount of time you require to focus on each subject is going to be different. But on average, you require 3 months. If you can get 3 months, 3 hours a day. So suppose, once a week, you're not able to study, twice a week, you're not able to study because of duties, that's perfectly okay. But on average, 4 days a week, if you're able to allocate 3 hours a day, you are more than, clear to pass your MRCS Part A exams. What are the books that you need? 2 books only. Raftery for basic sciences and Bailey and Love, short practice for surgery. This is going to be the crux of your preparation. You don't need to read anything more than that. And the most important resource is going to be a Mortimer Green app. It has around 3,000 questions. The most important part is the recalls. Recalls constitute a big chunk of your preparation, and the concepts are explained in detail. And the best part is we have test and discussions where we cover a topic every week, 1 or 2 topics every week. Rohan sir, me, and Dr. Praveen Sekaran and Dr. Sundaram. All 4 of us will be taking classes. We have a specific orthopedics class. So if you're a surgeon and you require some concept and grounding in orthopedics, we will cover that in detail as well. And the standard is definitely higher, as I told you, but that makes your preparation much more solid. If you're able to solve the Mortimer Green app, you can solve all the questions in past tests or EMRCS and do your exam extremely well. So Mortimer Green should be your one-stop solution. And for the past few years, we've guided more than 300, 400 students who exclusively use Mortimer Green resource and have passed MRCS Part A. So this is how your structure of the app is going to be. This is how the questions are going to be. And the questions are of a little higher standard, but yes, this will help you clear your questions. So the D&D starts soon on the 6th of June, and every Thursday we have classes. Rohan sir and I will be leading the class along with Praveen, Sekaran, and Pravin. And you're more than welcome to ask me any questions you want. You can put out your queries in the chat, and I would be more than happy to answer them. Test and discussion will be around 6:30 in the evening, but on some days it will vary. We might start at 5:30 or we might do it at 8 o'clock. It's going to be for 1 to 2 hours or even sometimes 3 hours, depending on the topic. And the sessions will be recorded for sure. Part A with NEET assist, definitely possible. We do have a lot of people preparing for that. And to be honest, when I was in MS, A lot of my mentors who prepared for MRCS Part A, they did along with NEET Assess, and it's not going to be too difficult. Anyway, you'll have to read Bailey for your NEET Assess, so it's going to be perfect. So I have a question where Nashwant is asking me whether the May session was very difficult, more than MBBS standards. Yes, the sessions are getting a little more difficult every year, but it's not too hard to prepare. We have had a lot of post MBBS students preparing very well and doing really well. So it's not going to be too difficult. But so the Mortimer Green app is going to be pretty crucial for in this particular aspect. The standard is a little higher, and we have deliberately made the standard a little higher. So I have a question from Ravi Kiran about MRCS ENT. It is different. The part A is common. The part B, OSCE part is very different. So I have a question from Arpit. We have neat PG notes for all basic subjects. Is it necessary to go through them for the basic sciences part? Actually, no. RAF tree is more than enough because it's more surgical oriented. For anatomy, you can go through your neat PG notes and solve questions on the Mortimer Green app and make a note of these points on the same notes so that you can focus on that a little with a little more gusto. And one thing which I would like to emphasize is that for part A, anatomy is going to be very important. And in anatomy, upper limb and lower limb anatomy, especially nerve injuries, is going to be super important. So I would ask you to focus on that as well. So Shrithama has asked me, I'm giving my DNB theory exam. Is it a good idea to write part A in September? Should I push it till July? If you're giving your final exam in October, I would ask you to push it till January for sure. Focus on one exam at a time. Even after an MCH with MRCS, will be eligible for ST3? No, you will be in a much better position. You can apply for ST5 or even ST6. Post MCH, MRCS, you are at a much better position. Image-based questions generally don't feature too much in MRCS Part A. For anatomy, I think RAF tree itself is pretty decent. And the Mortimer Green app is more than enough. I would ask you to focus on nerve injuries and upper limb and lower limb anatomy. Dr. Shruti has asked me, I'm a neurologist. Is MRCS mandatory before FRCS? Yes, absolutely. Since 2023, FRCS is absolutely mandatory. I'm also planning to give my FRCS maybe next year after I finish my MCH. I'm doing my MCH currently. So MRCS is absolutely mandatory for FRCS, be it FRCS general surgery or FRCS urology. So Parthiv has asked me a question. After clearing MRCS and practicing as a registrar in UK, how does the racial discrimination hinder the path over there? To be honest, many of your consultants are going to be Indians, and you really don't face too much of racial discrimination. I've had a lot of people go over there from our own students, our own mentors. Two of our mentors, Praveen Sekaran and Pravin Sundaram, are in UK right now. They are not facing any sort of racial discrimination. But if you really want to do, ask them. You can actually ask them. We can help you connect up with them as well. So Arvind Babu has asked me. He's a post-MS working as an assistant professor. Moderate work, how to plan for September session. Come back home, spend 3 hours a day with RAF3 and your Bailey and Love. Solve questions every day for at least 1 or 2 hours, 50 to 100 questions every day. And the most important part would be to attend the test and discussions to get an idea about how the exam structure is going to be. So Dr. Whitman has asked me, is MRCS necessary to do any fellowship in UK? So fellowships in UK are not exactly fellowships. So you join as a senior clinical fellow in department. The terminology varies from trust to trust. But one thing I would like to tell you is that MRCS makes it easy. There's one more pathway called the MTI pathway, Medical Training Initiative. It's kind of difficult to get in. It really depends on a lot of luck or recommendations. But you cannot go and work in UK after that. It's only for 2 years. You get a 2-year visa. So Reshma has asked me if RAF3 third edition is enough. Absolutely enough. No major difference at all. So Dr. Sanket has asked me a question. He's lost some money in the exam by not failing, and he's asked me, due to monetary constraints, is test and discussion really mandatory? Sanket, you just contact me directly. I will put my phone number over here so that we can talk. So any of you have a personal doubt, you can just contact me. So Larissa has asked me a video class, a book for anatomy. Raftery is more than enough, so you don't need to spend too much time. But use an atlas. Netto's atlas is great. We are also launching our videos. It's been a little delayed. A lot of people have been asking, and um, we are hoping to launch our anatomy videos in the next 1.5 months. So I think that will be pretty good as well. Arpit has asked me for surgery, is Bailey enough or any other resource needed? Absolutely not. You don't need any other resource. Mortimer Green app and Bailey. Narayan has asked me, he says he's doing 30 questions a day and making notes in Draftry from the app. So if I do the app twice before exams, do I have to read textbooks? I would still say go read Bailey and Love. Bailey and Love is not a very difficult textbook to read. It'll take you about 1.5 months to finish Bailey and Love. And you don't need to spend too much time in the basic parts of it. They don't really ask too much about it. Uh, and he's asked me whether it is necessary to subscribe for test and discussion while doing the app. The test and discussion adds a little more value to the app because you can ask doubts to the faculty, and we do discuss a lot of new recalls as well. So that's something which will be going to be useful for you. We explain certain important concepts for you, but if you feel that you are very thorough with the concept, the app is more than enough. So Dr. Hani has asked me, what's the chance of an MBBS intern clearing MRCS Part B? Absolutely good. A lot of people have passed Part B after MBBS. I have a lot of students personally who have done that, and they do really well. We do have courses 3 or 4 times a year in Chennai and Delhi, where we teach you how to go about the Part B exam. MRCS Part B exam is more about communication, history taking, doing certain procedures. So hands-on training is essential, and we do pretty well with that. So yeah. Jitin has asked me, is MRCS necessary for jobs in UAE? No, not necessary, but makes it a little easier and uh, makes it gives you a little higher salary. MRCS versus ISTB, what is the difference in career in UK? Dr. Shruti, I think we'll have to answer this in a little more detail. This is for post MS and MCH people. It's not related to the exam. So do contact me and I will put you in with the right people who would be able to guide you on the ISTB pathway as well. One thing I can assure you is whatever pathway you're choosing, an MRCS degree is going to be extremely useful because for FRCS, you need an MRCS. And if you're looking at a long-term career in the UK, I would suggest that you go for MRCS. Abhishek has asked me, are there any EMQs, extended match questions? Absolutely not. In 2018, they were phased out. Recent advances, not really. They don't ask too many recent advances in MRCS. Siddhartha has asked me, how does MRCS help people practicing in India? See, you cannot take it that MRCS is going to make you, give you 20, 40,000, 50,000 rupees extra salary in India. It does not. You definitely require skills to practice in India. That's the most important thing. However, in corporate, it gives you a little bit of added advantage when they're hiring you. It makes your resume look good. It looks good for the international patients, and it's a good marketable opportunity. But you should not think of it as a substitute for MS or surgical training in India. So Narayan Dora has asked me to make some videos free rapid revision. I'll try to do that for sure. Eve Komba has asked me which is best between past tests and EMRCS. That's a tough question. Past tests is slightly tougher. EMRCS is more reflective of the exam though. If you want the best of both, use Mortimer Green to prepare. So Vijeta has asked me, should I take other apps like EMRCS or past tests? If you're subscribing for Mortimer Green, all concepts in past tests and EMRCS are covered for sure. In fact, we are also adding more questions in the Mortimer Green app. So within the next 2 months, you would have almost 4,000 questions. If you're using Mortimer Green, then you don't need EMRCS or past tests. EMRCS is a slightly easier version, is what I would say. And pastors takes a little bit more time to prepare. But EMRCS, from a preparation perspective, it's slightly easier to read overall. Mortimer Green gives you the best balance of both. And Farshal Nawale has asked me, is there any substitute for Bailey and Love? Not really, but if you are in a shortage of time, just read the explanations in the practice mode in the questions. That's more than enough. Harikishan D has asked me, how difficult is it to join ST3 training in urology? It is competitive, but not impossible. Training pathways are difficult. I'll tell you what. Training pathway is difficult. ST3, you can get ST3 level jobs, but you may not be able to join ST3 training pathway without a lot of effort, a lot of publications. It's a whole different pathway completely. Hani Dayal has asked me, can I practice in India with MRCS and FRCS without doing MS? With MRCS, technically not allowed. A lot of people are doing, but MCI does not allow you. But with FRCS and CCT, which is Certificate of Completion Training in India, Certificate of Completion of Training in the UK, that you can do FRCS with CCT. Kamanaj has asked me, is MRCS Part B conducted in India? Absolutely, yes. A lot of centers in India every year. Vigneshwaran has asked me, can I register MRCS degree in MCI? Yes, you can. Narayan has asked me about mock tests. We launch mock tests about 1 week before the exam, and that's free of cost for everyone. Shritam has asked me how to know about the ST3 training pathways. We have a couple of videos on YouTube on our channel where Dr. Praveen Sekaran has spoken about it. We'll try. If those videos are not available, I'll try to make it available. Naveen Raj has asked me, can I get urology after MRCS? Definitely possible, but you may not be able to get into a training pathway, but into a non-training pathway, definitely yes. Not really, Akash. You can get into a training pathway. It's kind of difficult to get in, but it's not impossible for sure. That's more valid for core training, but at an ST3 level, you should be able to do it. If you're giving your NEET PG in June, then you have enough time for September. If as long as the exam is not postponed, July, August, more than enough time to prepare for MRCS Part A. I think it'd be better to do it as soon as after NEET PG because you're fresh with your basic sciences. So Narayan has asked me, do I have to regularly pay for the MRCS membership after clearing? Yes, every year you will have to pay an amount, 15,000 rupees approximately. So I think we're done with the questions. So I have one more question from Dr. Naveen Raj. Hey, so the thing is that there are multiple routes of getting your FRCS. One is a training pathway and the other one is a non-training pathway. In training pathway, you will be able to, you're assured of surgeries and you're assured of a pathway. In the non-training pathway, you might have to switch jobs, but you can still complete the requirements required for training. You'll have to get your certificate from the trainer saying that, he can suture the skin well, he can close the rectus sheath well. So there are multiple competencies which you'll have to get signed by a consultant. So if all the requirements are complete, you can, even without training pathway, we call it the CSR pathway, CESR pathway, you still can, get your FRCS and do your CCT. How's GI surgery training in UK? There's nothing called as GI surgery per se. There's colorectal HPB and upper GI surgery, and it's absolutely great. It really depends on which center you're working with. Some centers do bariatrics, some centers do esophageal cancers alone, some centers do a lot of core HPB, some centers do transplant. So it really depends on what you're interested. There's nothing called GI surgery per se. Part A, Part B, 7 years gap. Last date for MRCS Part A application, 27th of June. Bailey and Draftery, Part B prep is completely different, buddy. Part B prep is not dependent on Bailey and Draftery. You don't need both Bailey and Draftery. We do have a lot of PDFs, core materials. You can contact me. I'll share them with you. Narayan has asked me PDF for high yield topics which are not to be missed. I'll try to do that for sure. Dr. Eva will ask me, ENT year 2, I want to go to exams. If I qualify, do I get into 3 year in the UK or start afresh? You're in Zambia, by the way. So it depends. You can start at ST3 level for sure if you complete your MRCS ENT. Part A is common, Part B OSCE is different. And yes, you can start. You don't need to start afresh. You will start at ST3 level. You don't have to code training. Will you get Bangalore Center? Absolutely. Why not? You just have to, register on time. Naveen, I would say don't keep your hopes about the training pathway too high. Despite all this, the training pathways are notoriously difficult to get in. But even if you don't get into the training pathway, you can still become a consultant if you get your core competencies. You will still be allowed to do surgeries. Praveen Sundaram, that man was a topper. He'll be taking some of your September classes. One of the most genius surgeons I've ever met. He cleared every exam. He was DNB gold medalist. He got a top rank in surgical NEET essays, got into Tata. He didn't take it. He went to the UK. He's working in transplant. He's in a non-training job, and he's already started doing steps in transplant. He's already doing AV fistulas, and it's hardly been a month since he's joined. And it's hardly been 2 months since he's joined. And so, training pathway, non-training pathway. I'll have a separate session where Praveen Sekaran explains it. There was a session about 2 months ago. I'll make sure that he reconducts the session as well. Siddhartha asked me Edinburgh, Glasgow, England, what's the difference? Absolutely no difference. It's just a nominal this thing. Minor differences in cost. I think Ireland is slightly cheaper. But some people say it really does not matter, but Edinburgh and England are supposed to be more prestigious. But to be honest, for me, I don't think it really matters. How will the TND session be conducted? On Zoom every Thursday. Sometimes we might have midweek classes as well if you're not able to conduct a session on Thursday. All the sessions will be recorded, available in the app if you miss it, the sessions. The only reason why the sessions timings might be changed is because of our availability. We might get stuck in OT or something of that sort, but we'll try to conduct it most of it on Thursdays at 6:30 p.m. Hope the session was useful, guys. I'm excited to see you all. I really hope that you do well. And the session is always open. You can contact me. I'm available on most social media platforms. I actually do respond to them. Even if I don't respond, I respond. Even if I don't respond immediately, I respond within 3-4 days. So you can follow me on Instagram. I usually respond over there, and also on Twitter, where I keep posting updates about this thing. Vazia sheets are just basically questions. You don't need it, to be honest. Kind of outdated. They've not updated the recalls, but yeah. Narayan, mock test, I'll try to do it. But you can just take a trial on the app, Mortimer Green app, and you will realize that that's how the questions are going to be. But yes, I'll try to do a mock test. Yeah.
I have posted the link, sir.
You can post my personal link also, Ankur, so that they can contact me as well. Will TND session be enough for part A? I don't think it's about being enough. I think you require textbooks. TND gives you an idea about the exam overall. But yes, I would say go for textbook knowledge is actually good. A lot of people have, if you want to follow me on Twitter as well, you can. Uh, I do post updates and information about MRCS Part A exams on Twitter as well. So you can put it over there as well. Both Dr. Rohan and I respond to texts, and we're more than happy to help you out. And do register for the testing discussion. You can also contact us on the Mortimer Green helpline and the same, or by mail. We do respond for sure. Okay. Okay, guys. Have a lovely week. See you soon, and all the very best.